must know also the different types of nursing interventions, because I'm going to test you on it. When it comes to what you're doing, you got to know that there is nurse-initiated interventions, and this is where the nurse intervenes autonomously, independent of the physician. For example, I see the patient is turning blue. All right, you turning blue, your O2 sat on room air is 78%. I'm going to now autonomously and independently go ahead and apply that nasal cannula, administer oxygen at 2 liters. Now, please note, oxygen is a medication. But because my patient is turning blue, I'm not going to wait for the doctor to call me back 10 years later for an order. Okay? Because the doctor might be busy doing something else. You understand? So I have done this independent of someone else. That's nurse initiated. Okay? If I see the patient, for example, is at risk for developing a pressure ulcer, I'm not going to wait for an order from somebody to turn the patient every 2 hours. That's nurse initiated, okay? However, if the patient is in pain, okay, the doctor gave orders for pain medication. Now this is a physician initiated intervention because I have to rely on the physician to actually administer the pain medication to relieve the patient of their pain. Does that make sense? So nurse initiated, the nurse is acting independent of anybody. Physician initiated, the nurse has to rely on the physician's order to take care of the patient adequately. Okay? Does that make sense?